So moving on with the continuation of hypertension. Next is clinical manifestations. Now, what are the clinical manifestations of hypertension? You can just think for a few seconds. So hypertension means high blood pressure. So most of the time, whenever there is increase in the blood pressure, it is going to affect the heart. We already know that it will affect your heart, isn't it? There is increased workload on the heart. Not only the heart is affected, it can also affect many other vital organs, okay? But the effect on the vital organs is seen a little bit later. Initially, it will have effect on your heart, okay? So most of the time what happens is the heart may not receive enough amount of oxygen or blood supply because of the vasoconstriction, isn't it? So vasoconstriction happens in hypertension. So what will happen because of the vasoconstriction? There is narrowing of the blood vessels. So narrowing of the blood vessels, you know, the heart has to work harder to pump the blood. Along with that, what happens? The heart and the lungs will not receive enough amount of oxygen and blood circulation. And along with that, even the brain, that is the next vital organ, will not receive enough oxygen and blood supply. Okay. So because of that, so many symptoms will be seen in the patient. We'll see each one of it in detail. So initially the patient may not experience any signs and symptoms because of this hypertension. Okay. So most of the time what happens is the BP reading, when you're checking the BP reading, it will be high. And along with that, the patient usually complains of headache. Okay, the patient will be usually complaining of headache. Then dizziness, that is giddiness sensation. Along with that, patient can also have fatigue. Okay, that is extreme tiredness will be felt. Most of the patients may also have blurred vision and increased sweating, which is referred as diaphoresis. Okay, some patients may also have fainting episodes. Fainting episodes is nothing but dizziness or giddiness, okay, like syncope. Then they may also have vomiting. They can also have irregular heartbeat. Okay, they can also have irregular heartbeat. Palpitations may be there, confusion. Okay, nose bleeding is also very common, epistaxis. Okay, because of the increased pressure, there can be nose bleeding. Some patients may also experience chest pain. Okay, this chest pain is different from that of angina. Okay, next is dyspnea along with shortness of breath can be there. Irregular heartbeat. Okay, patient can have abnormal heart rate and heart rhythm. Along with that, they can also have buzzing sensation or tinnitus in the ear, that is ringing sensation in the ears could be there. Okay, arrhythmias is also very common, that is abnormal heart rate and heart rhythm. Further, what happens is when the blood pressure again continues to rise, okay, for a longer period of time, it can result in changes in the retina. Okay, so changes will be there in the retina and it may result in most of the time bleeding in the retina, which is called retinal hemorrhage, and cotton wool spots may be there. Because of that only the patient will have blurred vision. Next is papilledema will be there, that is swelling of the optic disc, and when the hypertension rises continuously, it may result in paralysis. Okay, most of the time paralysis of one side of the body may be there, hemiplegia can be there, paraplegia can be there, quadriplegia can be there. Okay, next is in some patients it can also result in angina. Okay, angina is nothing but the chest pain that is related to cardiac abnormalities. Okay, anginal, that is severe chest pain. Along with that, patient can have CVA. CVA means cerebrovascular accident. Okay, then that patient will be having stroke. Along with that, patient can have TIA. TIA refers to transient ischemic attack, which means mini stroke. Okay, the signs and symptoms of stroke will be present for 15 minutes or around 20 minutes for a lesser period of time. That is called transient ischemic attack. Some patients may also show renal failure or vision loss. Okay, remember this slide is not having the immediate clinical manifestations. These can be told as the complications also. Okay, so these symptoms are not seen immediately. The previous slides, what I have told, those are the immediate symptoms of hypertension. So next, now moving on to complications of hypertension. Now, what are the different complications of hypertension? Most of the time, the person with hypertension it is going to affect the entire vital organs, not only your heart. Okay, it will affect your heart, the kidneys may be affected, the vascular system, that is your extremities, may be affected. It may also affect your lungs, and it can mainly affect your brain. Okay, so most of the time hypertension, we can tell, it is going to affect your target organs. Okay, so the main vital organs are going to be affected because of hypertension. Okay, so we'll see each one of it in detail. So first of all, we will see the heart. In the heart, lot of changes occur. Okay, so the main complications of hypertension are hypertensive heart disease, hypertensive crisis, coronary artery disease, myocardial infarction, heart failure, arrhythmias, left ventricular hypertrophy, cardiomyopathy, and cardiac arrest. We'll see little bit detail in them. Okay, so complications of hypertension, very very important. So first of all, hypertensive heart disease. So what happens is, when there is increase in the blood pressure, okay, what will happen continuously when chronically there is increase in the blood pressure, it is going to affect your heart. And it is told that a person who is having hypertension for more than 10-15 years, it is going to have, or it may result in increased risk of, R bar O means increased risk of cardiovascular disorders. Okay, so person with hypertension will be having increased risk of cardiovascular disorders. Next is hypertensive crisis. Now, what is hypertensive crisis? Hypertensive crisis means, in this condition, the blood pressure will be usually increasing abruptly. Okay, and here usually the diastolic BP will be more than 140 mm of Hg. Okay, I'm speaking about diastolic, not systolic. Okay, so the diastolic only will become more than 140. So you can imagine how much severe hypertension it is. Okay, so most of the time hypertensive crisis, why it occurs is, suppose a person is not taking medications on time, or patient has suddenly stopped taking antihypertensive drugs, or the medications are not at all having any effect on them, or they are not aware that they are having hypertension. Along with hypertension, they are having any other chronic disorders. Okay, in that condition, patient can develop hypertensive crisis. Okay, sudden increase in the BP, that is diastolic BP, will be more than 140 mm. Okay, now under hypertensive crisis, we are having two main types. Okay, I'm just telling it. Okay, just telling it to increase your knowledge. You need not mention it anywhere. Okay, so under hypertensive crisis, two main types are there. One is hypertensive emergency and one more is hypertensive urgency. Okay, now under hypertensive emergency, the BP becomes more than 180 by 120 mm. Okay, hypertensive emergency, the BP is more than 180 by 120, and in hypertensive emergency, it is going to affect your all organs like your kidney, brain. Okay, will be affected. Okay, it will damage all the vital organs. The next type which I told was hypertensive urgency. Now hypertensive urgency also means elevation of the blood pressure, but here it will result in altered brain function. Okay, hypertensive urgency, here because of hypertension, the person's brain function will be altered. That time we call it as hypertensive encephalopathy. Okay, so hypertensive encephalopathy is going to result in signs and symptoms of the brain, maybe like confusion, or they may have a coma stage, headache, seizures. Okay, those all things will be seen. Okay, so just remember, hypertensive crisis is sudden severe increase in the blood pressure. Next complication is CAD. CAD means coronary artery disease. Now coronary artery disease is also referred as coronary atherosclerosis. The term is there here, atherosclerosis. So what happens here in coronary atherosclerosis or CAD is, there is abnormal deposition of fat or atheroma or plaque. All the the meaning is same. Okay, fat, atheroma or plaque means the same thing. That will deposit in the coronary artery. So what will happen when something is deposited, fat is getting deposited in the artery, arterial wall, it will obstruct or occlude the blood flow. What will happen when the blood flow is occluded? It will reduce the oxygenation, then the chances of increase of myocardial infarction will be there. That is MI. Okay. Next is about MI itself. So MI already I told you, myocardial infarction. Most of the time MI is told as heart attack. Why heart attack happens? Because of the obstruction to the blood flow. That is mainly because of ischemia. Okay, remember that MI means there is irreversible damage to the myocardium. What is irreversible and reversible? Reversible means it can be reversed. Irreversible is not reversible. So remember that in MI, usually there is irreversible damage to the myocardium. Why? Because of the ischemia. What is ischemia? Decreased blood flow and hypoxia, that is decreased oxygenation. Next important complication is heart failure. This also I have already told. Heart failure is the inability of the heart to pump. Okay, so what will happen when the heart is not able to pump the blood properly? The workload on the heart increases. Along with that, the metabolic demand will be more. That will not be met by the failed heart. Next is arrhythmias. Arrhythmias means abnormal heart rate and heart rhythm. Because of the heart failure, one more complication can happen, that is called as hypertrophy. Okay, so most of the time left ventricular hypertrophy occurs. Okay, so left ventricular hypertrophy usually is because of the increased workload on the heart. Okay, so prolonged increased workload on the heart, what will happen? The ventricles will become thickened or enlarged. That is called left ventricular hypertrophy. You will study it in detail when we come to heart failure. Okay. Next complication is cardiomyopathy. Now cardio means heart, myo refers to the muscle. So in cardiomyopathy, it mainly affects the not only the structure of the heart, but also it is going to reduce the function of your heart. Okay. Next is cardiac arrest. So don't get confused between this cardiac arrest and MI. MI means purely myocardial infarction or heart attack. Cardiac arrest means sudden stoppage of beating of the heart. The heart will stop beating suddenly. Okay, myocardial infarction means here what is happening? A particular region will have ischemia that is causing severe anginal pain. Cardiac arrest means heart will stop beating only. So most of the time a person who has cardiac arrest immediately will die. Next target organ is brain. Okay, till now we have seen the heart. Next is the brain. So why brain is affected here? Because there is decreased oxygenation and blood flow to the brain. Okay. So what and all symptoms are seen? What and all disorders are seen? Cerebrovascular accident or stroke. Okay, cerebrovascular accident is mainly because of decreased blood flow and oxygen to the brain. Next one is transient ischemic attack. Now transient ischemic attack means mini stroke. Already I told. Here the signs and symptoms of stroke is present for very less duration of time. Okay. Next is hemiplegia. Why hemiplegia? Hemiplegia is a type of stroke only. Okay. Reason is the same. There is paralysis of half side of the body. Next complication is hypertensive encephalopathy. So this is the one which I was telling during hypertensive crisis. Okay. So what happens is when there is sudden increase in your blood pressure, it is not only going to result or affect your heart, but also it is going to alter the blood flow to the brain. Okay. So there is alteration in the brain function also. The brain function will be reduced. So because of that, the patient will have signs and symptoms like headache, nausea, vomiting, confusion, seizures. The patient can go into coma in case of hypertensive encephalopathy. Next target organ which is damaged is peripheral vascular disease. Okay, peripheral vascular disease means it is affecting the peripheral extremities like your limbs. Here the patient will be having intermittent claudication. Intermittent claudication means severe pain in the calf muscles behind your leg, no? there is calf muscles. The calf muscles patient will have severe pain, especially pain will be more during exercise. It reduces during rest. That is why it is called intermittent. Along with that, the patient can also have paresthesia. Paresthesia means tingling and numbness. Okay, tingling sensation and numbness. Okay, so peripheral vascular diseases, it is going to affect your peripheral extremities. Along with that, it is going to affect your also some other parts, and it may result in aneurysm. Now, aneurysms means there is abnormal dilation and ballooning of the artery or the veins. Why aneurysms occur? It is mainly because of hypertension. Okay, so because of the abnormal increase in the BP, there will be development of some dilations or ballooning in the artery. We'll discuss regarding all these topics in detail. Okay, next is arteriosclerosis. Now, before I told coronary artery disease or coronary atherosclerosis, see the spelling here, this is a bit different. Now which I am displaying is arteriosclerosis. Now arteriosclerosis means abnormal thickening or hardening of the artery. Abnormal thickening or hardening of the arteries where there is loss of elasticity. Okay, that is called arteriosclerosis. Both arteriosclerosis and atherosclerosis develop over a period of time. The next target organ which is damaged is mainly your kidney. Okay, so in hypertension commonly it will affect the kidneys. Why? Because of the ischemia, renal ischemia. There is decreased blood flow to the kidneys. So what will happen? There can be abnormal thickening or hardening of the renal artery also. Okay, so that will cause nephrosclerosis. Along with that, the patient can have abnormal increase in the protein levels. Okay, and there can be excretion of protein in the urine. That is referred as proteinuria. Next is it may result in renal damage and renal failure. Next target organ which is damaged is eyes. Okay, next target organ damaged is eyes. So what happens to the eyes is most of the time it may result in retinal damage. Why? Because there is decreased blood flow to the region around your eye. Okay, so retinal damage will happen. What will happen when there is retinal damage? Blurred vision may be there and loss of vision may be there, or bleeding may be there in the retina. Next main complication under eyes is retinopathy. Okay, so about retinopathy we may discuss in detail. Okay, that is one of the major complications not only of diabetes mellitus but also hypertension, where there is damage to the retina and it will cause complete blindness. Okay, next complication is papilledema. Papilledema means swelling of the optic disc. Okay, then initially patient can have blurred vision, later it may cause vision loss. So you can go through some of these diagrams. Okay, so this is the figures that you can see in a person with the hypertension. Okay, you can see there are a lot of exudates, hemorrhages are there, cotton wool spots I told, no, which will result in blurred vision. So this is the summary of the complications again. Next is moving on to diagnostic procedures. Now, how are you going to diagnose hypertension? Already we have discussed regarding each of the diagnostic procedures in detail, so I will not explain any of it. Okay. So first of all, history has to be collected from the patient. What history you are going to ask regarding the present medical history, past medical history, regarding family history of hypertension. Okay, like who are suffering with hypertension, what type of a diet the patient is taking. Okay, or if they are taking any drugs already, what type of drugs they are taking, what type of occupation the patient is on, because sometimes already we discussed, isn't it, certain occupations the person is at increased risk of stress and all or tensions, so that can also result in hypertension. Then also ask them regarding any habits like smoking, alcoholism, or if the patient is chewing tobacco. Next is physical examination. So what you can do is check the blood pressure of the person. Okay. So always remember, checking the blood pressure will help to know if the patient is having hypertension. Then monitor the vital signs. Other than that, also check the BMI. Already we have seen how to check the BMI, isn't it? We should also ask the patient height and weight. Next is fundoscopy. Now, why we need fundoscopy of the eyes? Already I told you there are a lot of complications in the eye, isn't it? Like retinal hemorrhage is there, cotton wool spots are there, then it may cause damage to the retina, retinal hemorrhage, papilledema. To know all that, you should perform the fundoscopy of the eyes. Okay, that is, you can perform ophthalmoscopy. Okay, ophthalmoscopy is also called as fundoscopy. Okay, so which instrument you are using to check for fundoscopy or ophthalmoscopy? You are using the instrument ophthalmoscope. Okay. Next is blood investigations have to be performed, like complete blood count, lipids level. We know that cholesterol level may be increased in these patients, isn't it? So you can check the lipid level, cholesterol level, liver function test can be done, renal function test can be done, like your serum urea, creatinine, blood urea nitrogen. Okay. Then thyroid function test can be done. Okay, like T3, T4. Okay, all these levels can be checked. Along with that, blood sugars can be monitored. You can also perform urine analysis. Next is chest x-ray is one of the major diagnostic procedures that can be done to diagnose if the person is having any other problems. Next is ECG. ECG you are already knowing. It is a procedure or method to record the electrical activity of the heart. Okay. Next is echocardiogram. This also we have seen in detail. What you're doing in echocardiogram? It is a recording of mechanical activity of the heart. That is nothing but scanning of the heart. Other than that, CT scan, MRI also can be performed. Okay. So this one is regarding the clinical manifestations, complications and diagnostic procedures.